Does your corona test say that you are positive with a viral disease, yet you don't show any symptoms? No persistent dry cough, no recurrent sneezing, no flu, no chills or high fever is striking high on that mercury scale, no apparent loss of sense of taste or smell, no diarrhea? On the whole, you have no symptom that could classify as a corona patient. But apart from all this, you have those viral agents inside you as per the medical report. That means you are a carrier. This is Earthy Perks with a new episode to reveal about those asymptomatic carriers that are a constant threat to contain the disease. Now, let's first have a look at what these asymptomatic patients exactly mean. Asymptomatic refers to a person who has been infected by the virus, yet does not feel sick or show any symptoms. This is a bit different from pre-symptomatic, a person who does not show symptoms in early stages, but as the illness progresses, they do show vital symptoms. In the case of coronavirus, the ones who are not asymptomatic, the interval between infection and onset of symptoms is from day 1 to day 14. Most of them, with the onset of the disease, will show vital symptoms between day 5th to 6th. As per the list of symptoms issued by the World Health Organization, WHO, the apparent ones are fever, fatigue, and dry cough. Some of them may also experience aches and pains, sore throat, diarrhea, or loss of sense of smell or taste. But what about those who do not show any symptom at all? Can asymptomatic people spread coronavirus? Experts answer on this question with a yes. WHO has declared that asymptomatic people can transmit COVID-19, yet more research is required to map out the mode and extent of the transmission. Asymptomatic people have the capacity to shed the virus in many ways, including spitting, coughing, and sneezing. Infection can also be transmitted through direct contact with others, or by contaminating surfaces and objects. You'll rub your nose, you'll touch your mouth, you'll rub your eyes, and then you'll touch other surfaces. This is how you will be spreading a virus if you are infected and shedding the virus. Though limited to a smaller extent, yet these asymptomatic patients would be shedding lower viral copies. So, what next? Though they spread at a lower rate, yet they should be avoided. How can you protect yourself from these asymptomatic people? It is recommended to wash your hands at regular intervals with soap and water. Keep surfaces disinfected and objects clean, and use face masks in crowded places. Maintain a safe distance at least of 6 feet between yourself and others. Authorities should focus on tracing and isolating people who are infected with COVID-19, and anyone who has been in contact with them. China said 300 asymptomatic carriers of the novel coronavirus in Wuhan. In Vietnam, at time when the country just crossed a number of 300 COVID-19 cases, almost 37% were symptomless. South Korea said 20% to 30% of its confirmed cases were asymptomatic. The Philippines said about 13% of its nearly 19,000 cases were asymptomatic. In India, some 28% of 40,184 people who tested positive were asymptomatic. You cannot fight against unseen. So is the case with these asymptomatic patients. The only way to contain the disease is via social distancing and isolation. On this note, this is Earthy Perks signing off with a message that the one who is restricted is safe. Till next time, stay tuned and keep watching Earthy Perks.